Today, we are going to perform a trauma assessment. We begin with the scene size-up.
Sir, if you can hear me, open your eyes.
We approach the patient and begin our primary survey. First, we form a general impression, including estimating the age, sex, environment, and any immediate and obvious life threats. Measure responsiveness using the AVPU scale. If our patient is unresponsive, a carotid pulse and breathing check should immediately follow to identify the need for cardiopulmonary resuscitation. If our patient has a pulse, we return to our traditional assessment steps. After responsiveness, we identify the chief complaint. Airway assessment and management is next. If the patient cannot maintain their own airway, we open the airway with a modified jaw thrust technique. Next is suctioning, if necessary, followed by an airway adjunct. Once the airway is managed, we can move into our breathing assessment. Here, we evaluate respiratory rate, rhythm, quality, and volume to determine if breathing is adequate, inadequate, or absent. 2 initial lung sounds should follow, and ventilation or oxygenation of the patient based on their breathing status. To assess circulatory status, palpate a pulse, checking for rate, rhythm, and quality. Perform a blood sweep to identify any life-threatening bleeding. Assess skin for color, temperature, and condition, and treat for shock if found. At this point, determine if the patient priority of transport is either high or low. A rapid scan is next to identify injuries that are potentially life-threatening. Begin with the head. Palpate and inspect the skull, mandible, and maxillae for decap BTLS, deformities, contusions, abrasions, penetrations or punctures, burns, bruising, tenderness, lacerations, and swelling. The skull should also be assessed for crepitus. Next is the neck. Inspect the neck for jugular vein distension, tracheal deviation or shift, stoma or tracheostomy, subcutaneous emphysema, and any medical alert jewelry. Palpate the back of the neck for injury and decap BTLS. Measuring and applying a cervical collar can be performed at this time. The chest should be inspected and palpated. Start with the clavicles, sternum, and large sections of ribs. An additional set of 4 lung sounds should be performed now. You are assessing the chest for symmetry of breathing, equal and adequate rise and fall of the chest, and decap BTLS. The abdomen is divided into 4 quadrants using the mid-sagittal and umbilical planes. Palpate and inspect the quadrants for tenderness, rigidity, masses, distension, and discoloration. The pelvis is assessed for integrity by pushing on one iliac crest while noting the movement of the other. Switch sides and repeat. Push the pelvis together towards the midline. If you find an unstable pelvis, stop palpating to avoid further injury to the patient. Assess the lower extremity long bones for decap BTLS. At the foot, assess for presence of circulation, motor, and sensory nerve function. Assess the upper extremity long bones for decap BTLS. At the wrist, assess for presence of circulation, motor, and sensory nerve function. To assess the posterior of the patient, perform a log roll, ready to place the patient on a long spine board for transfer to the stretcher. Ensure that you have measured and applied a cervical collar before moving the patient. Inspect and palpate the posterior for decap BTLS.